Let's introduce the therapeutic use of dextrose. This is a term that encompasses three types of treatments. And prolotherapy is the one that you've heard the most about. That's injection of a non-biologic solution. In other words, not stem cells, not platelets, into connective tissue or joints to reduce chronic pain and dysfunction. Perineural injection treatment is the injection of fluid around nerves to reduce pain. Hydrodissection is when you use ultrasound to separate nerves from the cellophane-like layers, much more complex than that, but there's layers around the nerves that encase them and can create a compressive effect, specifically on their circulation, we think. This can impair the nutrition and their function. And this is also using the injection of fluid for that separation. It's like separating layers of an onion. Now, if you look at this slide, this compares dextrose prolotherapy, DPT, and PIT, perineural injection treatment, and hydrodissection. You'll note on the second column, the most common solution is 5% dextrose, or D5, for the PIT and hydrodissection. The prolotherapy solution typically uses 10% or more. And we talked about before, 10% is non-inflammatory. There's likely some additional benefit from a temporary inflammation. So often 12.5% or more dextrose is used. The guidance is by ultrasound for some prolotherapy or all prolotherapy, depending on the practitioner. And hydrodissection, of course, uses ultrasound guidance. The location of injection is typically underneath the skin for PIT, and as expected, within ligament, tendon, or joints for dextrose prolotherapy. And the mechanism is partially proliferative for dextrose prolotherapy. It has other ways it works. And in perineural injection treatment, it is considered to be primarily working on sensory neural or nerve pathways, of course. And then hydrodissection is expected to have both a decompressive effect by releasing the nerve and an effect on the nerve itself and how it functions. Separate from that,